Namaste and welcome to Yogami. I'm Malika, your trainer for today. Let's join the palms together right in front of the heart center and opening the chest here, keeping the neck, spine and the head in a straight line. Activating the outer edges of the legs and tucking in the tailbone. Centering yourself here in standing prayer pose or Setubandhasana. Gently releasing. And now let's begin with our warm-up. Taking about 4 feet distance between the feet and pointing the toes inwards, starting to rotate the hips. 7 to 8 times on each side. And really again working with your range of movement. Observing the stretch on the inner legs because of your toes pointing inwards. Seven to 8 times clockwise and 7 to 8 times anti-clockwise. Taking the feet together and placing the hands on the knees, rotating, making big circles and continuing with the same movement on the other side. Making sure your hands are not putting any pressure on the knees. And from here, taking one leg up to a 90-degree angle, keeping the thigh parallel to the ground, holding it there for a few seconds, and starting to rotate the ankle a few times on each side, keeping the movement isolated. Opening the leg outwards and holding it there. Coming back to the center, hugging it up, keeping your chest open and looking straight at a point in front of you, eye level. And from here, if you can, straighten the leg with the toes pointing inwards and drop the chest towards the knees as you do that. Gently bringing the legs to a 10-degree angle and inhaling, point. Exhaling, flex the toes towards you. Inhaling, point the toes downwards and exhaling, flex. Continuing that movement 4 to 5 times. And if you feel unstable staying on one leg for so long, feel free to use a support. And repeating the same on the other leg. So taking the left leg up, thigh parallel to the ground, holding it there at a 90-degree angle. And starting to rotate the ankles here. Other side. Big circles. Feel free to use a support. Or if you can, stay balanced. Keep your eyes at a point as you open the leg outwards. Feeling that nice hip opening. And hugging the knee into the chest. Keeping the chest open. And from here, gently straightening the leg with the toes pointing inwards. And bringing the chest a little bit in towards the thigh. Inhaling, pointing the toes down, exhaling, flexing upwards. Inhale, point, exhale, flex, feeling that nice stretch on the hamstrings and the quads here. Staying mindful of the sensations in the body. That completes our warm-up. Today we're going to be working on the Surya Namaskar variation flow, so let's get into it. People who are feeling bodily weak, have a bad back, pregnant women, high blood pressure and heart patients, people with arthritis or a wrist injury, please take care and check in before you start this variation flow. So let's get into it, starting with Setubandhasana, thumbs against the sternum. Inhaling, we arch the back to Uttanasana. Exhaling, we come down, arms and head together, pulling the spine inwards, aligning the forearms to the legs. Inhale, we take the hands on either side of the feet and take the right leg back, keeping our chin up. And exhaling, gently stepping back to downward dog, Adho Mukha Svanasana. Inhale, we place the knees on the mat. Exhaling, the chin and chest, elbows are tucked in here. Inhaling, we roll up like a cobra. And exhale, we gently move back to a downward dog. With the next inhale, we're going to just take the right foot forward between the hands to Ashwasanjalan. Exhaling, we step in, back to Padasana, forward fold. Inhaling, we go back, arms and head together, all the way back, only upper body. Exhaling, we come back to Sthit Pratnasana, standing prayer pose, keeping the tailbone tucked in. Inhale, we go back again to Uttanasana. Exhaling to Padasana, aligning the forearms, taking the forehead into the shins. Inhale, we take the left leg back. And I can even drop the left leg down. As you can see, I drop the knee down to make it a little bit easier of a variation. And exhale, I step back to my downward dog. Taking the chest in, gently inhaling, place the knees to the mat. Exhale, chin and chest. Inhale, I roll up, arching the back, and exhaling, getting back to downward dog. With the next inhale, I take my left foot forward. Exhale, I step back into the forward fold. Inhaling, I go back, arms and head together, only upper body. Exhale, I come back with my hands in Namaste and relax here.
Next, we will be practicing Malasana or the garland pose. People with knee and ankle injuries should avoid this posture. We begin with our feet at hip distance width. Keeping the toes pointed outwards slightly, I'm taking my hands in Namaste, getting into a deep squat right here, pushing the root of the hips into the ground. My heels are on the mat. If they don't reach, you can continue to push them down or even use the support of a wall. Adjusting the arms so the elbows are pushing the knees outwards, getting a beautiful stretch here for the thighs, the groin, the hips, the ankles and the torso. This posture also helps to increase blood circulation and blood flow to the pelvis. Gently releasing the posture using my arms and getting back to child's pose or balasana. Resting here for a few moments before we gently release the posture.
Next, we're going to be practicing Ustrasana or the camel pose. People with high blood pressure and severe fatigue should avoid this posture. If you have any sort of spine-related conditions, make sure to maintain the extension through the spine rather than bending the spine. Let's start by sitting in Vajrasana, and from here lift the body up and take the hands at the lower back, arch and look up. This is the beginner variation of this asana. Now, if you feel up to it, we want to maintain the toes and the heels in the same line and place the hands onto the ankles. We lift up from the chest and the pelvis, really dropping the head back down, maintaining the alignment of the shoulders and the hands. You're going to stay here for a few moments as per your comfort. And now, only if you're comfortable, you can even relax the feet all the way down and even deeper your extension of the camel pose. Again, we're dropping the head down, opening the chest up to the ceiling, and really releasing from the neck, dropping it back. Taking the support of your hands on the lower back, we come back up. Drop the hips back into the feet, back in Vajrasana. Exhale, we drop down all the way to a nice child's pose or balasana. The reason for doing this is to give the spine a nice counteractive bend. Since we did a back bend, we want to nicely release through a calming, fatigue-relieving forward bend. Gently coming back up and releasing the asana. Ustrasana strengthens the legs and the back and the spine. It helps with the mobility in the shoulders and the upper back. It stretches the front of the body and also strengthens the arms. Next, we're going to practice Naukasana or the boat pose. People with low blood pressure, severe headaches and migraines, people suffering from chronic diseases or spinal disorders are recommended to not practice this yoga pose. Women should also avoid it during pregnancy and the first 2 days of the menstrual cycle. Gonna start by sitting and finding the point of the tailbone, balancing the body there and lifting the legs up to form a 90-degree angle with the toes pointed inwards and the fingertips pointed forward. Keeping the abdominal muscles tight. You can also use the help of a wall to practice this posture if you need to. From here, we're going to lengthen the legs and go into a full variation with the toes pointing away from us and the fingertips pointing away too. Maintaining an angle for the body and keeping the abdomen tight. Taking long deep breaths here. Maintaining your balance by looking straight at one point. And gently releasing the posture and coming back to Sukhasana. Naukasana strengthens the abdominal muscles. It strengthens the muscles of the arms, thighs and shoulders. It also helps in regulating blood flow at sugar levels. Next, we're going to practice Baddha konasana. The contraindications for this posture are that people with any sort of knee conditions should not practice it. And if your knees are higher than your hips, you can also sit on a block. We're going to start by sitting in Bhadrasana, joining the feet together in Namaste and keeping the hands around the big toes. Elbows are bent and spine is straight. Holding this posture for a few moments with a soft gaze forward. Gently pushing the knees downwards, placing the elbows onto the thighs and dropping the head down. Lengthening from the crown of the head to the tailbone. And from here we're going to take our arms forward and really continue to lengthen. Staying in this posture for a few seconds. The benefits of this asana are that it helps open the hip and groin area, also improves digestion. This asana also relieves urinary disorders, regulates the menstrual flow. It is also great for kidney and bladder health and good for pregnant women. Gently walking back up with your hands and releasing the posture. Relax for a few seconds before we move on to the next asana. And now let's move on to Paschimottanasana. People with current back issues and sciatica should not practice it. So people with problems like slip disc that have come up recently should not practice this posture until they're completely cured. Also, pregnant women and people with liver and spleen issues should avoid this posture. We're going to start by sitting in Dhanurasana with our toes pointing inwards and our body in a straight line. Maintaining a 90-degree angle. Inhaling, we take our arms up, interlacing the fingers. Exhaling, we drop the spine down. And if your hands can't reach all the way forward, you can also place them to the lowest point or near the ankles, wherever you can reach. We want to try to lengthen our spine here, really going forward, lengthening from the crown to the tailbone. Ideally, keeping our elbows bent so that the strength of our arms helps us take the spine in even deeper. Inhaling, we come up, arms and head together and take the arms in a backward rotation. Now the benefits of this posture are that it stimulates the liver, the kidneys, the ovaries and the uterus, and also aids with digestion and stress relief. Next, we're going to be practicing the upward plank posture. We must avoid stretching the body beyond its limits as it may strain the muscle. It should be avoided by people who have a weak heart, wrists or ankles, or are suffering from high blood pressure. People with abdominal ulcers, hernia, cervical spondylitis, neck pain, knee pain, and back pain. We're going to start by sitting in Dhanurasana with our body in a straight line and the toes pointed inwards. We're going to take the hands behind a little bit and inhaling, we're going to lift up towards the sky, towards the ceiling, opening our chest and keeping the glutes tight. The wrists and the shoulders stay aligned and we gently drop the head back a little bit, allowing it to relax, continuing to get deeper into the posture as we hold. We lift the chest up and we lift the pelvic region up towards the ceiling. This asana is helpful in reducing the fat of the abdominal area and also helps get rid of a bloated belly. Also helps with the respiratory system by strengthening it and providing relief from asthma. We gently release and come back to Sukhasana. Let's go to the next asana. Next, we'll be practicing Bharadvajasana or Bharadvaja's twist. The contraindications to this posture are that we must avoid or modify it in case of any knee pain, ankle pain, hip, groin, or back injuries. We're going to start by sitting in Vajrasana and gently taking the legs out to the left side, placing the left hand on the right knee and opening the right shoulder. Holding for a few seconds, coming back to the center and taking the legs out to the right, placing the right hand right next to the left knee and opening the left shoulder. Holding that posture for a few moments. Coming back to the center. If comfortable, you can practice the next variation of this posture, where we let the right leg be where it is and place the left leg near the right hip bone, taking the left hand and holding the right leg, placing the right hand onto the left knee and twisting. We want to open our left shoulder here and look behind. Coming back to the center and placing the right foot now near the left hip bone, the left hand to the right knee and twisting again. Holding for a few moments. Coming back to the center. Now the benefits of this asana are that it improves postural and body awareness. It also helps to stimulate digestion, improves posture and counteracts the effects of sitting for long durations while you're doing your work on the computer or the laptop. Next we'll be practicing Dhanurasana or the bow pose. People with a neck injury or suffering from spondylitis, people suffering from ulcers in the stomach or from hernia, people also suffering with a back injury should avoid this posture. We're going to start by lying down on the tummy, keeping the body in a straight line, and the arms onto either side. From here, we're going to fold the legs in and take our hands on the ankles. Inhaling, I'm going to lift up, keeping the chest open and allowing the shoulders to be pushed backwards. Lifting the neck up. It is normal to feel a slight bob in the body initially, getting that nice arch in the spine. We're going to hold this posture for about 30 to 45 seconds. The bow pose is a great stretch for the spine, abdomen, hip flexors and biceps. Dhanurasana works in many ways to stretch out the body and its parts, stimulating its organs to perform at their optimum. Gently releasing, taking the support of your hands and coming back to Sukhasana. Let's go to the next asana. Next, we're going to practice Setubandhasana or the bridge pose. The contraindications for the same are people with back and neck injuries and also pregnant women. So if you fall under these categories, please avoid this asana. We're going to start by lying down on the spine with the feet kept close to the hips. Taking the arms on either side and lifting up, taking the pressure on the shoulders and not on the neck. We're going to lift the chest and the pelvis up towards the ceiling, keeping the glutes tight. Now we can also hold the ankles here or simply place the arms on either side with the palms facing downwards. So you can feel free to choose whichever variation. If possible, you can take the right leg up, keeping the toes reaching towards the ceiling and taking the left foot on the toes as well. We can stay here for a few seconds only if you feel like intensifying the asana and trying a variation. Slowly repeating the same thing on the left side. We're going to lift the left leg up, toes pointing upwards and stay there. Taking the right toes to the mat and lifting the heel off. Gently dropping back down and releasing the asana. Turning to your left side, supporting the body with the arms and coming back to Sukhasana. Let's go to the next asana. Now we're going to be practicing Jathara Parivartanasana. People with back pain or any sort of a spinal injury should only practice the easier variation. Menstruating and pregnant women should avoid this posture, and people who've had a recent surgery should also not practice it. Slowly lying down on your back with your feet placed close to the hips and arms on either side. We're going to take the arms shoulder level and drop the knees, knee on knee, ankle on ankle to the left side and look to the right. Holding this posture for around 30 seconds, maintaining the shoulders onto the ground, enjoying the supine twist. Bringing the legs back to the center and dropping to the other side. Knees to the right and looking to the left. Holding each side for about 30 seconds to a minute. This is an extremely relaxing posture and helps relieve stress and fatigue. Also tones the spine and removes any sort of stiffness. And to practice a deeper variation of this posture only if comfortable, we're going to take the legs up all the way to a 90 and drop them to the left, looking to the right. Our legs stay absolutely straight here. And we hold this posture for about 30 seconds. Bending the legs, bringing them to the center. Again, straightening them and dropping them to the right side, looking to the left. This posture also stimulates the large intestine and removes any stiffness in the spine and the shoulders. Holding it for about 30 seconds to a minute. Coming back to the center, turning to one side, and coming back up to Sukhasana. Let's go to the next asana. Next we'll be practicing Nadi shodhana or Anulom Vilom using retention. Children under the age of 12 years should not practice it, and cardiac patients should not exceed their time capacity. We're going to be practicing this pranayama with retention. We're going to start by sitting in Sukhasana, taking the right hand and bending in the middle finger and the index finger. Taking the right thumb and blocking the right nostril. Inhaling through the left, blocking both, and exhaling through the right nostril. And coming back. Great. We're going to take the right hand and practice 6 rounds of the same. We're going to keep the duration of the inhale, the retention, and the exhale the same. Making sure to keep the body still and the breath flowy, facial features relaxed, and no quick and jerky movements in the breathing. Nadi shodhana causes favorable pressure changes in the lungs for better oxygenation of the body. The practitioner experiences quietude and inner harmony. It also has a sedative effect on the nervous system and helps to improve concentration. and gently releasing. Next, we're going to be practicing the Pranayam Primary or the humming bee. We're going to start by sitting in Sukhasana using the index fingers to block the ears. You can also keep the hands right here and push the little flap in to block the ears. Inhaling, we're going to take a deep breath, expanding the belly, and exhaling with the humming bee sound, feeling the vibration in the throat. Blocking the ears. Inhale again, expanding the belly. Exhale, bringing the awareness to the vibration in the throat and blocking the ears. Now the humming sound doesn't have to be extremely loud, it can also be just a soft sound. What's important is we keep the body still and the facial features relaxed. Bhramari is good for the nervous system. It restores the elasticity of the lungs and also beneficial in asthmatic conditions. Practiced daily, it induces a meditative state and quietens the mind. It is beneficial in relieving from hypertension and stress. It relaxes the mind and lowers stress and reduces tension and anxiety. It also helps to reduce anger and frustration. And releasing the pranayam. Next, we'll be practicing the corpse pose or Shavasana, also known as the dead body posture. We're going to start by lying down on the back with the legs wider than hip distance apart and the arms on either side, palms facing upwards. Keeping the eyes shut and starting to feel the weight of the body on the ground, really surrendering to the force of gravity. Scanning the entire body for any tension or tightness and releasing it into the mat. Softening the facial features as we begin to consciously relax each part of the body, from the tips of the toes all the way to the crown of the head. Taking all the awareness to the toes, relaxing the toes, relaxing the soles of the feet, softening the ankles, relaxing the inner calves and the outer calves, releasing any tension in the knees and letting it go. Starting to relax the inner thighs and the outer thighs, releasing any tension or tightness and letting it go into the mat. Taking the awareness to the pelvic region and releasing any tightness, softening the hips and the glutes and relaxing the hamstrings, feeling the lower body melt into the mat and taking the awareness to the lower abdomen, relaxing the muscles of the lower abdomen, softening the navel, the upper abdomen, relaxing the chest and allowing it to feel lighter with each exhale, relaxing the shoulders and the area between the neck and the shoulders, starting to relax the biceps and the triceps, the elbows, the forearms, the wrists, the palms, the fingers, and the fingertips, feeling the arms lay back and surrender, taking the awareness to the spine, relaxing the lower back, the mid-back, and the upper back. One vertebral column after the other, starting to relax the back of the neck and the sides of the neck, releasing any pent-up tension you feel there by softening the muscles, relaxing the skull and the muscles of the head, starting to relax the forehead and the eyebrows, relaxing the area between the two eyebrows, taking the awareness to the eyes, letting the eyeballs fall back into the sockets and keeping the eyelids soft on the eyes, relaxing the nose, the cheeks and the jaws, keeping the mouth soft and letting the tongue fall back into the palate. Feeling a state of deep relaxation in the entire body and resting here in Shavasana for a few more moments, maintaining your stillness gently, starting to make yourself aware of the room you're in, making slight movements of the fingertips and the toes, hearing any sounds in your environment, and feeling the weight of your body on the mat, and allowing that gentle movement of the fingertips and the toes to bring you back to the present moment. Gently turning to your left side, supporting the head with the arm and keeping the body in a straight line, resting here on your side, maintaining a present state of mind, not worrying about the past and not thinking about the future. Taking the support of your hands and coming back into a seated posture with your eyes shut. Holding Sukhasana. Keeping the spine straight and taking the hands in Namaste as we begin to chant Om 3 times. To end our practice, take a deep breath in. Shanti, Shanti, Shanti. Rubbing the palms together and touching the hands to the back of the neck, the head, cupping the eyes, blinking and gently releasing as you open your eyes, feeling absolutely relaxed and renewed. Thank you for practicing with me and see you again for our next session on Yogami.